Let's talk about the pancreas today. Pancreas is an elongated tapered organ the shape of a banana located at the back of the upper part of the abdominal cavity behind the stomach. On the right side is the head and the first part of the small gut, the duodenum, extending from the stomach encircles the head of the pancreas. The pancreas, in addition to its head, has a body and tail segments. The bile duct, which conveys bile for the digestion of dietetic fat, including cholesterol, runs through the head of the pancreas to open into the second part of the duodenum. The main pancreatic duct also joins the common bile duct close to the duodenal gut, expanding into an ampulla. Let's talk about the purpose of the pancreatic organ in the body. There are two functions, endocrine and exocrine. Endocrine means the enzymes enter bloodstream directly from the gland, like insulin, a chemical that regulates blood sugar. The gland produces glucagon also to control and regulate the blood sugar. The exocrine functions are that the pancreas produces enzymes that help digest our food. They pass through the pancreatic duct into the gut to aid in digestion of food. They are protected in capsules to prevent damage to the pancreas and cause inflammation or pancreatitis in case they rupture. They are pancreatic amylase that break down carbohydrates, protease break down proteins into amino acids, lipase breaks down fat. These exocrine enzymes are wrapped in a protective layer, as mentioned, while they are in the pancreas to reach the gut. Once they are out of the pancreas, the protective layer is removed and the enzyme becomes active. The gland makes about 2.2 pints of enzymes a day for the digestion of regular 3 meals you consume. About 5% of the secretion is insulin secreted in the islet cells, which regulates the sugar level in the blood in addition to other functions. Now let's talk about the exocrine pancreatic insufficiency. If the pancreas does not make enough enzymes that your body needs to break down and absorb nutrients and can't absorb fats, some vitamins and minerals from foods, is referred to as exocrine pancreatic insufficiency. You will pass undigested food into the colon and will become weak and malnourished within a few days. There are pancreatic enzymes in drug forms to be given in such situations. The protease enzyme the gland secretes includes trypsin and chymotrypsin to break down proteins. Amylase is an enzyme secreted by the pancreas to break down carbohydrates. Let's talk about the insulin secretion. The islet cells secrete insulin and other hormones. Insulin regulates the blood sugar level in non-diabetics, and diabetics may need to be supplemented to maintain a blood sugar within the normal range. In diabetes, insufficient insulin is secreted or more will be formed if there's a condition called insulin resistance. Obesity seems to be one of the main causes of insulin resistance. By slimming, you increase your insulin sensitivity. When the blood When the blood sugar falls, the pancreas also secretes and release a hormone called glucagon. Glucagon helps to maintain the blood sugar level by releasing sugar from the liver stores. You will now realize the importance of having a well-functioning pancreas for digestion and absorption of food for health and well-being. Now let's talk about pancreatitis, which is inflammation of the pancreas. Your pancreas can get inflamed. This condition could be acute or chronic. Acute could be due to a minute stone obstructing the pancreatic duct. Intense pain in the upper belly or epigastrium could be due to acute pancreatitis. It can also be caused due to the gallstones obstructing the common bile duct and pancreatic ducts near the entrance of ducts to the duodenum. Other causes of acute pancreatitis are medications, autoimmune disease, infections, trauma, metabolic disorders, and after surgery. Chronic pancreatitis is a situation where the pancreatic enzymes start working within the gland without being released into the gut. Heavy drinking could be a factor. Increased levels of triglycerides in your blood or an immune system disorder can also cause chronic pancreatitis. Now let's talk about cystic fibrosis. In cystic fibrosis, the body makes unusually thick, sticky mucus due to a genetic disorder affecting mostly the lungs, pancreas, liver, kidneys, and intestines. Long term, the person finds it difficult to breathe and coughing up thick mucus. The condition is diagnosed by doing a sweat test and a genetic testing. The condition is treated with antibiotics and pancreatic enzyme replacement. Life expectancy is less than 40 years. Now let's talk about pancreatic cancer. Pancreatic cancer is quite common among Sri Lankans. Diets high in red meat consumption and eating fried foods and nitrosamines may increase risk of cancer. Diets high in fruits and vegetables seems to reduce the risk of pancreatic cancer. Cancer of the pancreas could occur following pancreatitis, diabetes, family history of genetic syndromes that can increase cancer risk, including BRCA2 gene mutation. High blood sugar raises the risk of pancreatic cancer, one of the deadliest forms of the disease. Life-threatening tumors are more common in people with hyperglycemia. Research has shown that high blood sugar could increase the risk of pancreatic cancer. A study of more than 25 million people found the killer disease is more common in adults with hyperglycemia. Let's discuss about the early symptoms of cancer of the pancreas. Yellow discoloration of the eyes due to jaundice caused due to obstruction in the biliary canal. Weight loss and poor appetite and upper abdominal pains are early symptoms. Research has shown that obese men and women have a high chance of getting pancreatic cancer. Chronic heavy alcohol use is also cause of both pancreatitis and cancer. hope you enjoyed watching this YouTube. It is important that you grasp the essence and add on to enrich your lifestyle. All cancers are preventable except those ones that are hereditary. It is our tasty, addictive dietary indulges and sedentary lifestyles, getting obese and lack of exercise that are main culprits of these dreaded diseases. Walking daily 10,000 steps may reduce the incidence. Try and eat home cooked foods with less salt, less oil, and unprocessed. Take care. Bye.